Jenny Finch is a softball champion. She's at home in the spotlight. But even while winning Olympic gold, she was coping with the intensely uncomfortable skin disease called atopic dermatitis.
Having atopic dermatitis definitely affected how I played and performed.
Atopic dermatitis is the most common form of eczema. It affects millions of Americans, causing red, inflamed, itchy skin. Small fluid-filled blisters may develop. In its most severe form, atopic dermatitis can have a serious impact on a person's quality of life. The itching can lead to scratching and inflammation, which in turn can cause bleeding and possible infection. While not life-threatening, atopic dermatitis can interfere with daily activities, sleep, and self-confidence.
Feeling uncomfortable, feeling insecure, not wanting others to stare at you or think you're different or thinking you have some sort of disease. You don't feel confident. You don't feel like you can be yourself.
Although atopic dermatitis cannot be cured, it can be managed in most patients. Jenny Finch and other patients are sharing their stories to help you learn more about this disease. Working with a board-certified dermatologist can help you effectively manage your atopic dermatitis.
This is a very exciting time to be a dermatologist caring for this condition because we have so many therapies that we can offer that we didn't have in years past.
The skin has two main layers. The dermis is the lower layer of the skin, which contains blood vessels, nerves, sweat glands, and many other important components. The epidermis is the skin's protective layer.
The epidermis has scaly cells that are constantly replenishing themselves.
The health of the skin can be affected by many things, including how much time you spend in the sun, your diet, family history, and allergies. Atopic dermatitis seems to be linked to having an immune system that's more reactive than normal.
We don't know for sure what causes atopic dermatitis. There's definitely thought to be a genetic component to it. So oftentimes patients will have family members that may have atopic dermatitis, or they may have family members that have other skin conditions, asthma, hay fever, because all of these allergic conditions tend to run together.
My brothers had allergies and asthma, and I had exercise-induced asthma with some allergies myself, so it was kind of all tied into one.
Even though people might refer to atopic dermatitis as eczema, these terms do not mean the same thing.
Eczema is a broad category of skin diseases, and there are several conditions that fall within that eczema umbrella. Atopic dermatitis is within the eczema umbrella.
As we've said, atopic dermatitis is the most common form of eczema. It is characterized by persistent underlying inflammation, even when you cannot see it on the surface.
As long as I can remember, I always suffered from just rashes and different flare-ups on my skin, itchiness and redness. Ready?
Atopic dermatitis frequently begins in infancy or childhood, although it sometimes develops much later. It can appear anywhere on the body, but often occurs on the face, neck, hands, creases of elbows, knees, and ankle joints.
Being a pitcher, atopic dermatitis would flare up in those spots where there was the most friction, whether it was under my arm most of the time, in my creases of my arms as well. Back of my knees was where it flared up.
The most common signs and symptoms of atopic dermatitis include dry, raised, inflamed, scaly, or crusty patches of skin. Intense itching can be unbearable for some patients.
It's not only the physical side of it, but it's the mental side of it, the emotional side of it. You know, when it's affecting your sleep and how you feel, and if you're constantly itching and irritable, it's no fun at all.
For Quincy, growing up with atopic dermatitis was excruciating. He was told not to scratch his skin, but that was hard.
What happened was I would scratch, I would rub, I would find anything I could to scratch, and it would just damage the skin, and sometimes it would bleed through the clothing.
The agony continued in college, where he ran track, and everyone could see his inflamed skin.
So I tried to get it under control as much as I could, but it was difficult.
After serving as a police officer, Quincy is now an investigator in a district attorney's office. He's trained to get the facts.
So I went to the dermatologist and got a lot of great information generally about taking care of your skin, but also specifically about atopic dermatitis.
It's important for each patient with atopic dermatitis to find a doctor who can be a partner with them in managing their skin condition, and to try to get their skin in the best condition it can be so that they can be comfortable and feel like they can live in their own skin.
A board-certified dermatologist is trained to distinguish atopic dermatitis from other disorders. To make the diagnosis, he or she will ask questions about a patient's medical history and may take a skin sample or order other tests. Good communication is essential.
When you're seeing a dermatologist in the office, it's important for you to tell about the symptoms that you're experiencing. So have you had any flares of your atopic dermatitis in the past few months since you've seen me? We need to get an assessment of how you're feeling and how much it's impacting your life. That allows us to provide appropriate therapy for you.
Hello. Hi, Kathy. How are you doing?
Kathy's career as a credit union manager means she is constantly meeting customers. That's a big problem when atopic dermatitis flares up on her face and fingers.
It may just be my own insecurities where I feel, gosh, someone may not want to shake my hand. And while I know it's not contagious, they don't.
But with her doctor's help, Kathy is finding ways to manage her disease and care for her skin.
So if you can keep the area well moisturized and very soft and supple, when it bends, then it doesn't break and crack and fissure, so it will be less painful to you. This is not a one-size-fits-all. There can be a variety of therapies, and it really takes the partnership between a dermatologist as well as a patient to select what therapy is the most appropriate for that individual at that point in time.
There are 3 basic kinds of treatment for atopic dermatitis. Topical treatments are medicines applied directly to the skin in the form of ointments, creams, lotions, oils, and gels. Moisturizers help reduce skin itching, cracking, and crusting. The American Academy of Dermatology calls moisturizers the cornerstone of all atopic dermatitis treatment and recommends that they be included in every patient's treatment plan.
This is every time you've washed your hands, you want to do this.
Corticosteroids can reduce inflammation and itching. They should be used only as directed to reduce side effects such as thinning of the skin. A number of other topical medicines are available as well, including non-steroid anti-inflammatory medications. Light therapy, also called phototherapy, uses special light bulbs that create ultraviolet light, which can help control atopic dermatitis. Under a dermatologist's care, light therapy treatments can be given at the doctor's office or at home. Systemic therapy works from the inside out. It addresses the immune system's reaction that may lead to atopic dermatitis.
Then what that means is sometimes you can take pills or you can have injected medications that will allow you to control the inflammatory portion of the condition.
Another key to treatment is working with a dermatologist to identify and manage triggers. That can make a big difference in coping with the condition. As an athlete and a mom, Jenny Finch is proactive in managing her atopic dermatitis.
I learned how to deal with it and how to put myself in the best position possible when it was flaring up.
When her son was also diagnosed with atopic dermatitis, she started keeping a journal to help identify what makes the condition worse.
I think journaling is so important because then when you go to your doctor, you can have that journal there to refer to and find out what affects it and what makes it feel better, and then go from there.
If you have atopic dermatitis, you are at higher risk of developing allergies, and these can also trigger flares. It can take time and patience to figure out what can trigger your atopic dermatitis. There's a long list of possibilities in the air around you, in the products you use, the clothes you wear, the food you eat, the pet you love. If you're allergic to it, it may trigger an attack, so patch testing and allergy testing can be part of developing a treatment plan if allergies are suspected.
There are many different factors that can flare the atopic dermatitis, and oftentimes doing diagnostic testing where we're looking for allergies in the environment that could be triggering their skin. And that will allow them to create a regimen where they can feel comfortable in their skin.
In addition to allergic reactions, some things may make atopic dermatitis worse, like hot baths, infections, dry air, and stress.
So stress is kind of like the volume knob on a stereo. It's not the underlying reason that you have the atopic dermatitis, but it can make your skin feel much more angry and much worse.
Kathy relieves stress by heading outdoors, even though she knows she might run into triggers.
And because I love the outdoors, I'm outside exposed to grass and weeds and pollens that are really my enemies.
But that doesn't stop her from training for marathons. Instead, she and her doctor have come up with strategies for managing her atopic dermatitis, so she can do what she loves. What Daniel loves is the martial art practice called jiu-jitsu, but it requires close personal contact. For a long time, his atopic dermatitis made that impossible.
I'd actually started jiu-jitsu and I'd had to stop. When I spoke to my dermatologist, she asked essentially what are the things that you're hoping to achieve. Everybody would like to say, I'd like to never see this condition again, but that's just not realistic. But I told her I'm a pretty active guy. I like to keep up with my kids and I like to do lots of exercise, and the exercise that I do, you tend to sweat a lot, and sweat's a pretty common trigger.
With his doctor's guidance, Daniel was able to resume his active lifestyle. He stays hydrated and avoids taking hot showers. His regimen also includes topical treatments and an oral medication. His concerns about atopic dermatitis are in the rear-view mirror. He can enjoy his family life without worrying about when the next flare-up may occur, because when it does, he knows how to handle it.
It's livable to the point where it's not a point of discussion anymore around my house in the way it was when it was just out of control and it was the conversation that we were constantly having. Now it's just something that we maintain and live with.
Atopic dermatitis cannot be cured, but as we've seen, there are many ways to treat and manage this chronic disease. A board-certified dermatologist can help you identify triggers and develop an individual treatment plan that's right for you.
And it's always so satisfying to be able to take a person who's been suffering for years and have them come in and work with them in a partnership and develop a diagnostic regimen, find out their triggers, to develop a therapeutic regimen, to get them feeling good.
Be proactive, speak with your dermatologist, be honest, and find a solution for you to be able to be the best that you can be.